Alright, let's review the distal femur, the proximal tibia, the patella, as well as the fibula coming on the outside. If we look at the distal femur, we can see we have come down from the anterior side and we have a nice surface right in here. That's known as the patellar surface, because that is where the patella sits in. We follow that surface, we go underneath, and we see two condyles. We look at the head being medial, going into the body, this being a right femur. This will be the medial condyle, this is the lateral condyle. In between the two condyles, we have the intercondylar fossa. Above, or on the side, the widest points of the two condyles will be the medial and lateral epicondyle. The medial epicondyle has a little bit of a bump as we go more proximal, superior. That bump is the adductor tubercle. When we follow what we said was the linea aspera in the back, we follow that towards the lateral condyle, we see where it splits. You see the lateral one much more prominent, but there's also a medial. Those are two ridges, and they are the medial and the lateral supracondylar ridge. When we look at the patella, we have a rougher anterior surface, and we have a smoother posterior surface. The posterior surface comes up like to a little tip. If you look at it, and it has two facets, two areas where they make a joint with the patellar surface of the femur. The lateral facet is wider and larger than the medial facet. We turn it back over, we also have in the front, we see how it comes to a tip, that's the apex of the patella, and the base, which is the broader place. When we actually want to know what side of the leg this patella is from, we can take the apex away from us, lay it down, and see which side it tips. This one tips to the right, so it is a right patella. When we talk about the tibia, we have the proximal tibia right here, widens up, and will make a joint with the femur in what we know as the articular surfaces of the tibia. We go a little bit to the side where it gets a little bit wider, which is in this bone is broken off a little bit. We have condyles. So the tibial condyles is where we sort of expect there to be epicondyles. We have a lateral and we have a medial. This here is the medial, this here is the lateral. We will see that when we look at the distal end. The medial side will have what's known as the tibial and the medial malleolus. And in between the articular surfaces, we have an intercondylar eminence, it's called. And the intercondylar eminence has both a lateral and a medial tubercle. So this is the lateral tubercle of the intercondylar eminence, this is the medial tubercle of the intercondylar eminence. This is where the internal ligaments of the knee joint will attach. That will be in the front. We have a bump that's pretty pronounced, and that's the tibial tuberosity. That will be the attachment side for the quadriceps muscle, the knee extensors. Then lastly, in terms of the bones that we talk about here, we have the fibula, and the fibula runs on the lateral side, right here, and the landmark that we have for our proximal end of the leg we'll have is the head of the fibula right in here. The knee joint, this being a right knee, is the fibula on the outside. Patella, of course, being in the front, anterior. The knee joint has two menisci that stabilize it. They're laying on the tibial articular surfaces on the tibia. They're C-shaped, they're fibrocartilage. They just, when we look into the knee joint, we will have two internal ligaments. One in the front, that's known as the anterior cruciate ligament or the ACL, and that one goes from the medial tubercle on the anterior side, the medial tubercle of the intercondylar eminence, and it attaches fairly posteriorly into the lateral condyle of the femur. The posterior cruciate ligament runs behind it, and it runs from the lateral tubercle of the intercondylar eminence, and it will go into the medial end of the condyle more anteriorly. These ligaments, they are called the cruciate ligaments because they make like a cross. Like if I have a right leg right here, take my right hand and bring the middle finger over the index finger, and the middle finger becomes the ACL, the index finger becomes the PCL. Then we got a joint capsule around this whole structure. And on the outside we have what's known as the two collateral ligaments. We have a lateral collateral ligament, sometimes it's called a fibular collateral ligament because it attaches into the head of the fibula. And then we have a medial collateral ligament on the inside. Lastly on here, we want to differentiate between the quadriceps tendon and the patellar ligament. The quadriceps tendon, the tendon attaches a muscle to a bone. So the quadriceps tendon comes from the quadriceps muscle and attaches into sort of the patella, which is a sesamoid bone. Then from the patella, which is a bone, we'll have the patellar ligament anchoring the quadriceps group into the tibia and the tibial tuberosity.